Hey everyone, what's up? Dr. Charlie Johnson, physical therapist. Hope you are well. In this video, I want to talk about how you can sort of lean into your own natural instinct and or intuition as it relates to really listening to your body and to your mind and resolving any form of back, butt, or sciatica problem you have. Again, so many people look outside of themselves to resolve this problem. They have to go to the chiro or go to the PT or go to the massage therapist, oftentimes for many, many years. Right? You watching this, and have you seen the same massage therapist, the same chiro, the same PT for months and or years and or maybe decades for a very similar problem? You can do that if you want, but I suggest that you can learn to do it yourself, all right? Again, for those of you who are watching, my name is Dr. Charlie, physical therapist. I am a PT. I'm my orthopedic board specialty, and I work with people all around the world with back, butt, and sciatica problems. The goal is to teach you how to resolve your own pain using the power of your mind and movement as medicine. Basically, I can give you the tools, the knowledge, and the understanding you need to resolve this. Now, we'll call this video something like, Go with the Flow. Some geese. Oh, moon. Look, there's moon, right? All right, anyway, squirrel. All right, go with the flow. All right, sort of like those birds. They're just flying along and they're following the currents. All right, you know, I'm sure they have a destination, but they're just kind of going with the flow. They're not resisting it. They're not fighting it, right? And so much about trying to get out of pain for so many people is about fighting the problem, always trying to figure it out. But do you need to, right? And so one thing I want to bring up with this whole go with the flow thing, so I can get into it finally. All right, here we go. Is that sometimes your pain is going to shift. Sometimes your pain is going to move around. And the first natural instinct for most people is to kind of freak out, to spiral back into problem-solving mode, right? Well, why is it doing that? And what does that mean? And to kind of stay locked into one very linear way of thinking, right? So sitting with your back up tall is the best way to do it. You need to sit with that lumbar roll. Sleeping on your stomach is bad. You should do this. You shouldn't do that. And what this does for us, again, is it keeps us locked and it keeps us in pain because we're not flexible, we're not agile. And so something I want you to think about, if you have some type of back, butt, sciatica problem and you're trying lots of different stuff, is things are going to shift around. They're going to move. And you need to be willing to move with it. So just the other day I had someone reach out and said, Charlie, like sitting up tall used to be the most comfortable thing for me. But now it's not. In fact, now I kind of like leaning back. But that's not good. Another belief system that comes into play here, right? I said, what do you mean that's not good? She said, well, like I was told that's not good, and that used to be something that would make me worse, but now it makes me feel better, so what do I do? And I said, just go with it. Go with the flow. Well, why is that happening? Well, we could talk about why that's happening, but it would just be a circular conversation based off of theory. And so look, you're not always going to have all the answers. And here's the cool thing. You don't need to have all the answers. If one day sitting up tall seems to help, great. If one day slouching seems to help, great. If one day sleeping with your right leg up feels good, great. If the other day sleep with your left leg feels good, awesome. It's all good. It's all good, folks. All good in the hood. And so just like the leaves are just kind of blowing in the breeze, and the birds kind of doing whatever they do, and that flag over there is just blowing the way it blows. It'd be so much easier if we didn't have like minds attached to all this, right? We're trying to figure things out. I doubt the leaves are trying to figure out why they're blowing this way today and then the other way tomorrow, right? And so at the end of the day, try to detach from that. Try to let go of like, why is this happening all the time, right? Now, I think it's smart to do some detective work and figure out, okay, well, you know, maybe why does this make sense, or, you know, kind of what's going on here. But beyond a superficial level, beyond running some basic tests and looking at the data, sometimes you just got to go with the flow. That which you resist persists. All right. And so the harder you try to fight this thing, the more you try to problem solve it and figure out, you're just going to keep yourself in a high state of hypervigilance, high alert. You're probably going to end up stressing yourself out more. And here's the thing. You're probably not going to be able to figure it out either. I can't tell you how many times me and my buddies, when I used to teach at the University of Southern California, Again, I have my orthopedic board specialty, residency trained from USC here in the US, and bunch of nerds, you know, that's what we are. We really love what we do, and we're always trying to figure stuff out. I think it's good, right? Critical appraisal of what we're doing and why we're doing things, especially in medicine and things that are always changing, right? But man, a lot of 2 a.m. talks about, well, why does the piriformis do this? And why does the disc do this? And why sometimes this? And why sometimes that? And I'll tell you what, we would sit there for hours. And at the end of the day, it's like, well, that was a good talk, guys, but I'm not sure we got anywhere, right? And the reason is because nobody has all the answers. So don't expect yourself to have all the answers. Go with the flow. If you're watching this and you're trying to find comfort, you're trying to get relief, don't listen to what someone else is saying. Listen to what they're teaching and or the concepts they're trying to give to you if they're emphasizing teaching you versus fixing you. It's hard to find nowadays, all right? But go with the flow, all right? Don't be afraid to listen to your intuition, listen to your gut, and just be like, hey, that just feels good, man. I don't know why that feels good. It's kind of weird, right? And don't start thinking, well, is that going to throw my hip out of alignment? Is that going to rotate this? Is that going to cause my psoas to tighten up? Is that good for the piriformis, or is it bad for the piriformis? What's good for the piriformis is what feels good, all right? We don't know nearly as much as we think we do about this stuff, all right? And so instead of trying to treat your diagnosis, treat your movement pain relationship or your mind pain relationship. Your movement pain relationship would be like, yeah, like, you know what? To that lady who reached out to me or who I was chatting with or I was coaching, Charlie, it feels really good today when I lean back. But a week ago, it didn't. It used to feel good when I was sitting up tall. I said, just go with the flow. Slouch then. Slouch all you want. Lean into, picture this like a river. Lean into yummy. Follow yummy. Why it switches, hard to say. There are some theories there, right? But just go with the flow, all right? It's okay if things change. It's okay if things morph. And just listen to your body and listen to your mind too. You're going to pick up on certain things. You're going to find that certain events tend to increase symptoms more than others, all right? Maybe certain stressful events at work or this or that. And that's okay too, right? So then, rather than trying to figure everything out, what things can I put in place to maybe reduce that stress, all right? Maybe you take walks frequently throughout the day. Movement as medicine also helps clear the mind, right? Distract and or break up that high alert state. Maybe instead of checking emails first thing when you wake up or right when you get in the office, you do it twice a day. And so you block your email checking. You change your workflow to reduce that stress if you notice that mind pain relationship. All right. And so rather than treating the diagnosis or what you think is going on or what's happening in my disc when I do this, when I do that, dude, it just feels better. It just feels better when I do that. So go with the flow. I get that you're going to want to try to problem solve it and figure it out. But at the end of the day, it really doesn't matter. All right, so give yourself permission to just trust in yourself, trust in what feels best, again, mentally and physically, and lean into it. All right, just like a river, just like a boat going downstream, it's going to just let it go. Let it go with the current, let it go with the tide. Sorry if there's a little wind. The leaves are just blowing the way they want. The birds are just kind of, whoo, they're just going this way and then they're going that way, right? And remember, try not to resist it, all right? So that's all I got for this video. I'll kind of quit the rambling. Hopefully that is useful. Hopefully that inspires you again to just listen to your own body versus listening to everyone else who's telling you, you should do this, you shouldn't do that. You're going to get it from friends, from family members, from your chiropractor, from your PT, right? From your doctors. That's not good. You shouldn't lift this. You'll never be able to do that. It's like, well, what if I want to do that? What if that feels good? Who should I listen to? There's like this internal conflict. There is no internal conflict, all right? Healing can come from within. Listen to yourself, listen to your mind, listen to your body, all right? That's all I got. Again, this is Dr. Charlie PT. By the way, if you're looking to better understand the process that we use to help people like you all around the world resolve their back, butt, sciatica problems, be sure to check out a free workshop that I have created. Again, gives you some tips and tricks as well as insights and sort of a different way to view this problem. so you can, again, start to think about it differently. Because if you're going to want a different result, you're going to have to do something different. All right, thanks so much. Appreciate everyone. Chat soon.